Welcome, everyone, to A Mexican Crossing Lines with your host, Cindy Gomez-Schempp.
And Duke Gomez-Schempp.
You're listening to 88.1 FM, KPPPLP Fargo-Moorhead, where we are adding local color to your airwaves. And tonight, I am going to be talking about the COVID casualties. There are many casualties to this virus, including things that aren't contagious to people. Like, for example, Bernie Sanders' campaign.
Oh, yeah.
It's gone. They're out. And I'm going to talk about all of the casualties. We're going to bring you up to date on the numbers around the globe, in the U.S., in our county, in the Fargo-Moorhead metro region. We're going to tell you what's going on with the ever-growing number of animal sightings that we're having, wild animals coming into our cities, moose and coyotes and bears and
all my, yes.
It's crazy. We're going to talk about all of that. And of course, I'm going to bring you an update about the COVIDiots out there. What are the COVIDiots and the con artists, the activists that are mercenary activists taking advantage of the pandemic to defraud people? All of that coming up on today's show. I want to thank everyone that has sent me information. Thanks for watching out. We really couldn't do this without all of your support and all of your comments. And of course, I invite you all to like if you're watching us on YouTube, if you're following us on our social media platforms, make sure to share this. If you aren't, please follow us on our social media platforms, on Facebook, on Twitter, on YouTube, and of course, make sure to consider giving us a tax-deductible donation to support the work of this station.
Yes, and thank you for supporting us and being there for us. Some of you have been with us for years. One reason we have a very successful low-power FM radio station is we broadcast in the Fargo-Moorhead area on terrestrial radio, and we've been doing lives, Facebook Lives and YouTube Lives for several years now, or at least a year and a half or so. And it has reached an audience that's nationwide and international. And the people in the Fargo-Moorhead area that are driving around their cars or have radios in their houses that have been listening to us, they support us as well. So thank you very much for being involved in our community-run nonprofit radio station. If you would like to get hold of us, you can call us at a call-in line, 701-566-0917. Again, that number is 701-566-0917. You can also contact Cindy at kpppfm.com or me, Duke, at kpppfm.com. You can go to our Facebook pages, 88.1 FM Fargo-Moorhead, the People's Press Project, a Mexi-Can. You can also go to YouTube at Duke1517. That's a channel that we're simulcasting on now, over on YouTube and on Facebook Live at the same time. Also, when you're on kpppfm.com, don't hesitate to look around and poke around and look at different pages. Look at our programming. Look at some of the stuff we've accomplished. Also, help support independent media. Go to kpppfm.com/donate. Make a donation. If you're on the Super Chat tonight on YouTube, make a contribution there. We love having people be involved, and we appreciate the support you've given us, and we appreciate that you're here tonight.
Fantastic. Yes. And I'm going to start off with giving you the world numbers. Let's take a look. I always refresh right as I'm giving you the numbers because they're changing so rapidly that I want to give you the latest up to the minute count. The total confirmed cases worldwide is now 1,511,104. How much is that up from the time we took the screenshot?
14,000.
Wow. Okay. Mexico, guys. Mexico is now up to 2,785 cases. That's our neighbor to the south. Our neighbor to the south is already that, in the thousands, infected in the thousands. And Canada, our neighbors to the north, are almost up to 20,000. They're at 19,141 cases currently. So those numbers are continuing to rise, and the total deaths around the world are at 88,338. It's almost 1,000
Almost
more.
1,000, yeah.
Jeez. It's not even an hour ago. And then let's go to the U.S. numbers. In the United States, we have 400,000, more than 400,000 cases. We're up to 427,346 cases.
About 5,000 death increase in the past hour.
In the past hour. Remember when we would look at the change between the time that we screen captured and that we went on the air?
Yep.
And it would go up by hundreds, and that was really scary.
It was very, very scary, disturbing, yes.
When we were watching it go up by hundreds, now it's going up by thousands in an hour.
Wow.
I mean, it's just days ago that we were reporting that it would go up several hundred in the time that we went on the air. But now it's going up by the thousands every time we go on the air. The total number of deaths is 14,678. And the total recovered is 22,314.
Wow. So a couple of more 100 people died in the past hour.
Right.
In the United States.
In the United States. And New York is now at 149,316 total cases. They have a total of 6,268 deaths. I mean, that's three 9/11s. I mean,
yeah,
it's
exactly.
It's a really astonishing number. It's staggering, the number of deaths, and to think that we haven't hit the peak yet.
No.
Although you said that there's some hope. You were listening to the press conferences today, and people were talking about the possibility of the line or the numbers of people going into the hospital.
Yeah, I think
down,
it was in Washington. They were talking about they were starting to see it kind of quit rising so sharply, kind of potentially leveling. And I think in another state they were talking about that. And it's like, it's very hopeful, but it's like, you've been seeing what people have been doing, out playing basketball, not practicing social distancing. In some of the states they are, and their numbers are leveled out. But in the places that had huger outbreaks, if they're leveling out, that's really, really good news. But it's always too early to make assumptions at this point.
It definitely is. We have a comment from Joy saying that they're taking down their field hospital. Not one patient was put into their field hospital. And also we have a comment from 2 America 1. How many died that did not have the virus? Oh, we're going to be talking about that and the discrepancy in the reporting. And it's going to be a mess. 2 America 1, thank you for the question. And also thank you for the $10 contribution.
Oh, thank you.
Really appreciate every dollar that keeps us on the air, especially through this pandemic counts. So thank you very much from the bottom of our hearts. Let me just tell you that there is a real issue with that, and I'm going to be covering some of that, especially with regard to what's going on in New York further down in the program. But first, I want to share with you what our Minnesota cases are like.
Yeah, Minnesota, it's the death toll is actually up to 39 people who have died. There's been 85 new cases in the past day. The total positive cases are 1,154. Of those 1,154, 632 people have recovered and no longer need isolation. 135 people are in the hospital from the virus. 64 of those are in ICU. So those numbers isn't not as bad as New York, but this is Minnesota, and this is early on for our state. So it's something to be concerned about. Now, when it comes to North Dakota, we're on a border city. We're on the border of North Dakota, Minnesota, and that's why I report both of these. But North Dakota had 14 new positive cases, and bringing the total to 251 cases. Now, in North Dakota, it goes up about 10 to 15 to 20 each day. And part of that is because of Cass County. That's the county that we live in, or we live next to. And Cass County is the largest populated area of the state. And there were See, 1, 2, 3, 4, 5, 6, 7 cases in Cass County reported today. Man in his 40s, community spread. Man in his 30s, close contact. Woman in her 30s, community spread. Man in his 40s, community spread. Woman in her 90s, close contact. Man in his 60s, close contact. And woman in her 60s,
under
investigation, because they don't quite know how that happened. So it's like, that's startling, because once again, the mayor in Fargo and West Fargo told people to start staying home and did an executive order as a mayor and said that people have to stay home. There's not a shelter in place. People can still leave, but they're trying to keep people from running around playing basketball, going to the stores together and not having the social distancing. And we can see it reflected in those numbers that, 9, 10, 15 people every day are becoming infected in the county that's right next to us. Here in our county, it's about 30. So it's like there's 30 cases here in Moorhead, basically. And that's startling, too, because we've been in home, for 3 weeks, and the cases are still going up.
And they're making models now for Minnesota and North Dakota. And what the models are showing is that there are going to be more people infected in North Dakota than in Minnesota. And I think it has to do with the stay-at-home orders that were issued by Governor Tim Walz and the fact that Governor Burgum has not issued that. So there are a lot of people that are just kind of, going about their business as usual. And,
people are starting to take precautions. For example, in Fargo, a mail delivery person has come down with the virus.
Really?
Yeah, and that's startling because we get our mail every day. We rely on our mail. We rely on things getting delivered to us. And this is our mailman today. He basically is wearing...
And he's wearing gloves.
He's wearing gloves and he's got a mask. But what's wrong with this picture?
It's he doesn't have it over his nose.
That's right.
And that means that he could be breathing the virus straight in through his nose, or expelling it from his nose. If he sneezes, the sneeze or the cough, it will come out of his nose too. So
yeah, but at least he's wearing gloves, which is another one. His protection, our protection.
Yes.
Also,
improvement.
Yes. So what was wrong with this picture? Got to pull that mask over your nose, buddy. And we all need to practice, the right protection. Now, here's another picture. This is at Eventide, a nursing home over here in South Moorhead. They are wearing masks, but this is basically, I said, did you know you can schedule a virtual visit? Because they're basically putting residents in isolation. But what's wrong with this picture?
Well, they're very, very close. He's touching the person. They're not wearing gloves. The residents are not wearing masks, so they're completely unprotected. Mm-hmm. And I guess that the purpose of having these conferences or appointments. Okay, I'm going to rant a little bit, just a little tiny bit. Okay.
All right.
First of all, they should have quarantined certain staff in place and made the decision from the beginning not to have the traveling doctor coming. And the traveling doctor that goes from our hospital and clinic to all of the nursing homes and is basically a walking petri dish that ended up catching COVID and probably has infected a number of residents at a number of these facilities already. Mm-hmm. What we've learned since that announcement over a week ago is that another nursing home had a resident that contracted the illness, and the nursing home did not make that information known to the public. They may have contacted the person's family, but they did not tell the public, and we have a right to know that. But as I also told you, nursing homes do not have to tell.
That's right. They're private institutions.
They're private institutions, so they can choose to stay silent, which is horrifying because by the time they make it public, there's a bunch of deaths. And I'm trying to be upbeat. I'm trying to be hopeful, but my daughter works at one of these facilities, and it really disturbs me that during a pandemic, there aren't any, state or federal directives that require transparency from these facilities that house some of the most vulnerable populations within them.
Yeah.
Are elderly. And so for those reasons, I think that they should be upfront with their protocols. I think they should be very open. I think that they should have taken those steps in the beginning. I think they should have taken more steps to have people come and get their family members, especially if they had underlying conditions.
Exactly.
Or just because they're older and they needed to be quarantined. I think they should have made decisions to pay a certain amount of staff to stay on site and quarantine for the duration of the pandemic, not to leave, whoever could do that, so that they don't keep having people going in and out. Because if you have people going in and out, eventually the virus is going to get in.
Mm-hmm.
And when that happens, it's going to spread like wildfire, and there's not going to be anything to stop it.
That's right.
So, Teresa comments that don't wear gloves. It's like a nurse changing diapers and then passing meds without changing the gloves, coming from a nurse. Good point. And cross-contamination is an issue. But what I feel that it is, showing us in that picture that we saw is that the people that work there, like my daughter, are very close to the residents. They're doing their teleconferencing calls with over the phone with the residents. And they're not practicing the social distancing necessary. I mean, that's not social distancing.
Yeah, and it's I understand leaving washing the hands, cleaning the phone, changing the mask. But both people should have a mask on. And I understand human contact. It's very important for people, especially if they're in an institution like a nursing home. But come on, this it's very disturbing.
Mm-hmm. Joyce Snyder comments that this was started in their nursing home, a staff member at a nursing home. So, you would think that they would be regulated. That's very true to America, because, they do house the most vulnerable people. The nursing home. Joy continues saying that the nursing home has now been fined $600,000 by the feds. Wow. So you could get in trouble.
Okay.
Sounds like you can get in trouble.
Mm-hmm.
So I think that it should be mandatory that nursing homes have transparency and report exactly what is going on. And I wanted to share for folks in this area that the Moorhead water situation, we were on a water restriction or, restricted use for a while because we had water backing up, and the sanitary sewer systems serving the area from Main Avenue and south from 8th Street to the Red River have now returned to acceptable conditions.
So you can use your water, but we still should conserve,
But you can resume using, your regular amount of water.
Exactly.
Now, I talked to you about there was a cougar, was it, or a bobcat that was in West Fargo recently?
It was a mountain lion.
A mountain lion. Okay. A mountain lion was recently shot. They had to put it down because it was exhibiting a lack of fear of humans.
Yeah.
And now we have a bear in Minnesota. And it looks like it's not afraid of humans either.
No, it's looking for garbage. He was walking around, and the person across the street just filmed the whole thing.
Is that common in Minnesota? I've never seen bears in the entire time that I've lived here.
Oh well, yeah.
But you grew up here, so
I've seen a lot of bears. But they're usually in state parks, dumpster diving, And I've done a lot of camping in Minnesota. And further north you go into Minnesota, into the woods, there's a brown bear and black bear and grizzly bear. And so you have to be really cautious when you camp and those sorts of things. But, bears are common, but they usually, you don't see them much. Out of all the years, I've probably seen 3-4 bears in my whole life. But I've never seen bears in the city, in towns.
Okay. Betty Davis comments that doctors, by law, Must see patients monthly unless called and the patient has changes. Teleappointment rules? I don't know. It's all up in the air with everything having to do with this pandemic. We don't know. So, folks, there is a very shocking interview that talks about, I recommend you go over to KX4 and listen to POV, or you can find them on POV Now on Facebook if you are outside of the Fargo metro area. Senator Dr. Scott Jensen was interviewed by my colleague and friend over there at KVLY, Chris Berg, and it was just a stunning interview about a 7-page document sent by the Department of Health to this doctor, basically coaching him on how to fill out death certificates.
Wow.
I took a clip from it. We will share the link to the video on our Facebook page. So if you're watching us on YouTube, make sure to go over to our Facebook comments, and you'll be able to find it there. But I wanted to tell folks that this is just a must hear interview. You must hear this whole interview. It's 8 minutes long. It's too long for us to play it for you here. But here's just an excerpt of what he had to say.
I think that, well, in Minnesota, as a physician, I received an email last week from the Department of Health coaching me on how to fill out death certificates. And I've never really received coaching from the Vital Statistics Agency in terms of how to do a death certificate. But basically, I felt like they were saying, you know, you don't have to have a confirmed laboratory test for COVID-19 in order to make the death certificate be COVID-19.
So wait. Sir, I don't mean to interrupt you, but that and what you just said, I think is critically important. Can you repeat what you just said, please?
Well, last Friday, I received a 7-page document that sort of told me that if I had an 86-year-old patient that had pneumonia but was never tested for COVID-19, but sometime after she came down with pneumonia, we learned that she had been exposed to her son who had no symptoms, but later on was identified with COVID-19, that it would be appropriate to diagnose on the death certificate COVID-19. Now, we've not done that. If someone has the pneumonia after and it's in the middle of a flu epidemic, and I don't have a test on influenza, I don't diagnose influenza on the death certificate. I will say this elderly patient died of pneumonia.
I don't mean to interrupt you, but my heart is sinking right now as you're telling me this. You're a doctor. Why in the world would they be sending you out information to fill out death certificates, whether the person's been diagnosed with COVID-19 or not, but then to say in the death certificate this person's death was caused by COVID-19? That does not sound right to me.
I went to the person in our office who does most of the death certificates over the last 10, 20 years, and I said, does this sound right? I had her look at the documents that I printed off, and she said, well, we've always been told that you always put down just facts. You don't put down any probabilities. You don't put any presumptions down. It's just what you know. And so this is concerning, and it actually...
Boy.
Your thoughts, Duke?
Well, there's going to be wrong numbers. It sounds to me like it's manipulation, the way it's being laid out in the program. And that they would put something down that actually didn't have the factual information for. So I think that is concerning. The thing that's behind it, people are starting to wonder about the numbers, but I don't want people to suddenly go into don't trust any of the numbers. We can't trust China's numbers, or we can start saying we can't trust Johns Hopkins numbers. But if they're not being reported properly, they're incorrect. But I just caution people to go in that direction that makes us think this is not as much of a concern as we thought it was. Because remember, the more we do, the more we get ahead of it. And if we find out we wasted some of our time doing things that really weren't necessary, we're better off in case the stuff keeps on escalating and keeps on going and keeps on growing and keeps on causing more and more and more deaths. I mean, how many deaths are okay? I mean, when you have 30 in Minnesota dead, and if that doubles to 60, is that okay? It's not okay at all.
Of course not. It's not okay. Yeah, and Governor Cuomo said even one death is too many. It's no deaths, no amount of deaths is acceptable. Obviously, I think, there's a balance here between getting the right information and having a lack of awareness or a mistrust of the totality of the information to the point that we disregard the fact that we need to stem the progression of this virus, because we do have to continue to do that. So we have to stay vigilant. We have to listen to the stay-at-home recommendations and orders that are in place. We have to continue to practice social distancing, washing our hands, disinfecting everything, all of it. And we have to believe that, if we see the numbers rising, that we still have something to contend with here that's very, very serious. But at the same time, I'm very concerned at the end of this, there will be so much for us to take away from it, to learn about what you need to be prepared for and how to do this better, because it could happen again, and it might happen again in our generation. I mean, this hasn't happened for like 100 and some years, right? So
it might happen again in the fall.
But it could happen again very soon. And if we don't learn the true numbers, the true takeaways from this, I think that we're not going to be as well prepared. That's my concern.
Very good point.
And there are other casualties besides deaths. One of them has been in the agriculture industry.
Yeah.
We were watching milk
be dumped because they couldn't take it to market.
Yeah, because they couldn't take it to the market. And that's also happening with acres of fruits and vegetables. Sadly, we lost our graphic and everything. I know what happened there. Thousands of acres of fruits and vegetables growing in Florida are being plowed over or left to rot because the farmers can't sell to restaurants or theme parks.
Wow.
Everything is closed. This is horrifying and sad.
Mm-hmm.
And I mean, there's so much food insecurity. It's a gut punch to see food being thrown away. And I don't understand why they can't salvage any of that.
Yeah.
Why can't they?
I don't know.
I don't get it.
Yeah, I don't get it either.
It's being plowed over. It hurts my heart. It hurts my heart to see it. Now let's go to the numbers of deaths in New York. There's a staggering surge of New Yorkers dying in their homes.
Oh, my goodness.
Suggesting the city is undercounting the coronavirus fatalities. Here's another, hole, here's another crack where numbers and people are falling through and we're not getting correct numbers. And this is due to the fact that people are dying in their homes, and they're not normally dying at this rate. So if you die in your home of the coronavirus, there's a good chance that you will not be included in the official death toll because of a discrepancy in their reporting process in New York. The problem means that the city's official death count is likely far lower than the real toll taken by this virus, according to public health officials. It also means that victims without access to testing are not being counted, and even epidemiologists are left without a full understanding of the pandemic. As of Monday afternoon, 2,738 New York residents have died from confirmed cases of COVID-19, according to the city's Department of Health. There's an average of 245 a day since previous Monday. But another 200 city residents are now dying at home each day, compared to 20 to 25 prior to the pandemic. That's a big jump.
Yeah, it is.
A huge jump. And a spokesperson for the medical examiner's office gave us that number. And an untold number of the cases of people dying at home are unconfirmed. And that's because the medical examiner's office is not testing dead bodies for COVID-19.
Oh, boy.
We don't have enough tests to test all of our medical professionals, and we don't have enough tests to test all of the living Americans. So dead Americans are not being tested. It's not a priority.
Yeah,
we don't have the capacity. Instead, they're being referred to as suspected cases, and the city's health department is putting them down as probable death of COVID. So the quote is, if someone dies at home and we go to the home and there are signs of influenza, our medical examiner may determine the cause of death was clearly an influenza-like illness, potentially COVID-19, or an influenza-like illness believed to be COVID. We report all our deaths citywide to the health department, who releases the data to the public. But the health department doesn't include the numbers in the official count unless they are confirmed COVID with a test, a spokesperson from the medical examiner's office said. The health department said, quote, every person with a lab confirmed COVID-19 diagnosis is counted in the number of fatalities, the spokesman Michael Lanza said in an email. He said the city's coronavirus death tally does not break down who died at home versus who died in a hospital from the virus. So that's a problem.
Oh, yeah.
And I don't know. What do you make of the undercounts, the quality, designating people as dying from COVID when we don't know if they really died from COVID?
Well, what's hard is that, especially in the areas that are hardest hit, and the amount of people, like in New York, once a person is deceased, it's like wasting time on something that seems sort of unnecessary because you got a whole bunch of other people to treat and to deal with. So to go and test the people that are already dead to see if it was, the virus or not, there's some element that I think is like, that would be unnecessary. So they're guessing at these things and kind of looking at, was it that, or was it, the flu, or was it some other complications? In the perfect world, we want full documentation of everything, but people are being triaged, and this is an emergency. This is a pandemic. It's worldwide, and there are people dying all over the world. So it's like, once again, that would probably lead to the numbers being undercounted, but then people are saying they're being overcounted. It still doesn't matter because there's still people dying. That's what I think.
Let me read to you from the email that Senator Scott Jensen referred to in that interview with Chris Berg. It was just sent to me via email, and I have the email sent to the doctor by the Department of Health for Minnesota's Department of Health. And this is what it says under the section titled Advice for Physicians, Physician's Assistants, and Advanced Practice Registered Nurses Who Certify Deaths. Take immediate action when you become aware that a patient has died and you need to provide a cause of death statement. Timely certification of all deaths are critical during the pandemic. MRNC will send an email, and the record will appear in your MRNC cause of death work queue. Consider designating staff to enter your cause of death statement into our MRNC on your behalf if you are out of the office, working remotely, or if your operations in your clinic or facility are temporarily irregular. Work out coverage with other medical certifiers who have access to patients' medical records. Provide the date that you last saw the decedent. A telemedicine appointment is acceptable. So if you saw them over a teleconference, that counts as the date that the decedent was last seen. Provide cause of death information based on your best medical opinion using the information available to you. For guidance on how to enter a cause of death into MRNC, see the MRNC for Medical Certifiers webpage. Know that your cause of death statement is necessary for medical examiners and coroners to authorize cremation. Timely disposition is critical during the pandemic.
Wow.
So they need to get these certificates done quickly, and they need that so that they can cremate the bodies.
Wow.
Respond to medical examiners and coroners if they contact you about a death record. You can request the OVR correct information about the cause of death anytime, even after issuance of certificates. Report coronavirus disease 2019 or COVID-19 on death certificates for all decedents where the disease caused is assumed to have caused or contributed to the death.
Okay.
Including as much detail as possible based on your knowledge of the patients, the medical records, the laboratory tests. If the decedent had the chronic conditions such as COPD or asthma that may have also contributed, report the conditions in Part 2. So that gives you a little bit more detail, a little bit more insight into what is going on as you know, they're trying to count the number of deaths. And apparently, as I'm reading that email, this is also critical to making sure they can dispose, cremate.
Quickly, yeah.
Yes. Isn't that what your take on that was, dude?
Yeah, it sure was. It sure was.
So let me get to some more comments here. Someone asked why the food isn't being given away. Me too. I think that's very sad. Melissa VC says, is Bernie donating his campaign donations to the coronavirus? Shrug emoji.
Yeah.
Good question, Melissa. Wouldn't we all like to know?
But actually, on that note, I just have to make a comment because political elections, national elections, have always bothered me because of the millions and millions and millions of dollars that the candidates spend. And there's all these candidates in the Democrat side and, you know, spending all this money for this useless stuff, I think, because that's a lot of money that could be going to people. So, yeah, that money should be donated. In fact, I don't think they can. Well, no, they can. I remember I was a treasurer for a county commission race here once, and we would donate the leftover money to a nonprofit. So, you know, you could legally donate that money to something else and not stick it in your pockets. But the millions of dollars that are spent in a presidential election is disgusting when there's so many people in need and so much financial hardship, especially now.
Exactly. Beth comments, if people have other health conditions, the virus can have an easier effect to kill people, and whomever can say another health condition killed them. Yeah. There's a lot of things that are kind of, we don't know. And again, we're going to have to take lessons from what we're learning from the pandemic and figure out a better way to do it if it comes around again. Meanwhile, Rikers Island prisoners are being offered personal protection equipment and $6 an hour to dig mass graves.
Jeez.
Terrifying.
Yes, that is terrifying.
Terrifying. Oh, by the way, going back to this story, I wanted to go back to the story in New York because I wanted to give you some more details that are kind of interesting and disturbing and have to do with diagnosis and all of that. It says that while underdiagnosed cases that result in at-home deaths are connected to a public health pandemic, not all suspected COVID-19 deaths are brought in for examination by OCME, nor do we provide testing in most of these natural at-home deaths. Typically, when someone dies at home, a loved one, acquaintance, neighbor, someone calls police or 911. First responders call the medical examiner who conducts a review to determine if there was foul play and then records a cause of death. Worthy Davis could not immediately provide a tally of how many probable COVID-19 deaths have been referred to the health department. The health department also could not provide the number of probable COVID deaths certified by OCME. A person that has been tested before death, that a record would be passed along. If a person had been tested before their death, then that record could be passed along to said Worthy Davis. But testing protocols have generally excluded victims who haven't been hospitalized. Statistics from the fire department, which runs EMS, confirms a staggering rise in the number of deaths occurring at the scene before first responders can even transport people to the hospital for care. So once again, those are not getting counted. If the fire department says it responded to 2,192 cases of deaths at home between March 20th and April 5th, That's about 130 per day, an almost 400% increase from the same time last year. In 2019, there were just 453 cardiac arrest calls where a patient died, according to the fire department, FDNY, for the entire year, for the whole year. That number has been steadily increasing since March 30th, with 241 New Yorkers dying at home just this last Sunday. More than the number of confirmed COVID-19 deaths that occurred citywide that whole day.
Yeah.
On Monday night, the city reported 266 new deaths, suggesting the possibility of a 40% undercount of coronavirus-related deaths. This is astonishing to me, Duke.
Yeah, it is because...
Go ahead.
When people started saying that it was no different than the flu season, and they quoted like 60,000 people died in the United States of the flu last year. It's like people weren't dying this quick. People are dying left and right, and they're dying in every state and, all over this country. And so the deaths are increasing and increasing and increasing. And we can worry about the correct count and everything. I think it's very important to get the most accurate and correct count, but there's too many pieces of it that there is inaccuracies. But the thing that's out there is that there's a lot of people passing away. A lot of people are dying.
And I'm sure that some of them are having to quarantine, are falling sick. And I wouldn't even be surprised if there's people that are quitting because it's getting out of hand.
Yeah.
Miss Tingley comments that she found out that one girl doctor from New York City isn't a doctor. It was a fraud. Oh, interesting. And then we have another comment from Melissa Vesey saying, a New York doctor from Manhattan, New York City, showed up next door to my sister's river home outside of Erie, Pennsylvania. Why are they leaving? Yes, that's very interesting. Sherry comments, I wonder if they could do a swab or blood draw before cremation or burial to check for COVID-19. Then update death certificates as needed. Hey, there's a suggestion.
Yeah.
I don't know how it works, but I really feel like we're not going to really know unless they do something. And of course, during a pandemic, they need to try to bury or get rid of the bodies as quickly as possible, because after the body is dead, it still is shedding virus for quite a while. And we can't have that. So, that is obviously a big concern. But let me tell you what a spokesperson for Bill de Blasio said. They didn't return a call for comment about the differences between probable and confirmed COVID deaths, but the discrepancy troubled public health authorities and local elected officials. Quote, there's no doubt that we are undercounting, said City Councilman Mark Levine, who chairs the city's health committee. Quote, if the person had a confirmed test result before death, then they were marked that was a cause of death on their death certificate. If someone did not have a confirmed test, but it appeared that they had the symptoms, then OCME will flag them as a possible COVID death. It's unclear to me whether those are being counted in our total stats. Dr. Erwin Redlener, the director of Columbia University's National Center for Disease Preparedness, called the discrepancies, quote, a subset of the whole testing fiasco. He said the city should be testing dead bodies and reporting the results. I think so too. Quote, the difference between the medical examiner and the health department, that's something that needs to be resolved urgently. It's not okay, Redlener said. They have to be on the same page. Redlener said that the city should also be tracking other deaths that occur as a result of collateral damage. Quote, people may be dying because of reduced care for people that are not COVID related, such as diabetes, heart attacks, or other chronic conditions. Those, to me, should be somehow tallied as we're looking at all of the death toll. Yeah. So that's, one of the concerns I have too. What are the real casualties? What's the real casualty count? Because all of the people that have a heart attack, that have a car accident, that have a diabetic, go into a diabetic coma, et cetera, et cetera, et cetera. And they can't get care because of the overflow of COVID patients and die as a result of not being able to get that care. They're casualties as well. Don't you think so?
For sure.
Okay. So, sorry, Rikers Island. Let's go back to the Rikers story. It turns out that it's true that they are actually going to be paying these individuals, or at least they have offered these individuals from Rikers Island to work on mass graves on Hart Island, according to sources with knowledge of this offer. Avery Cohen, a spokesperson for the mayor's office, Mayor Bill de Blasio's office, confirmed the arrangement, but said it was not COVID specific, noting prisoners have also been digging graves just in general on Hart Island for years. The offer is only being made to those with convictions, not those jailed before trial, as is the general case. A memo sent to prisoners, according to a source who reviewed it, doesn't specify whether the work on Hart Island will be, or what the work will be, but the reference to personal protective equipment leaves little doubt.
Yeah, no kidding.
The offer comes as New York continues to be the epicenter of the coronavirus pandemic in the United States, with 38,000 people infected and more than 914 dead. Well, of course, you know that number has jumped dramatically since this article was issued.
Exactly.
New York owns and operates a public cemetery on Hart Island, which has long been maintained by prison labor. The island was identified as a potential resting place for a surge of bodies in the event of a pandemic by a 2008 report that was put together by the New York City's Office of Medical Examiner. Hart Island, though, quote, has limited burial space, the report noted, and may not be able to accommodate a large influx of decedents requiring burial, which the preparedness plan estimated at between 50,000 and 200,000 in a pandemic with a mortality rate of 2%, in which 25 to 35% of the population of New York got infected. The city document proposed employing the Department of Defense's temporary mass interment method, mass graves, which places caskets 10 in a row, head to foot, so as not to stack them on top of each other. Hart Island is located off City Island in the Bronx. In 2008, Rikers prisoners were burying roughly 20 to 25 bodies per week there.
This is horrible. This is a horrible thing to even... Let's exploit people in the middle of a pandemic. Offer them $6 an hour instead of 50 cents or whatever it was before. This sets with me so wrong. People are coming together to work in our communities to help each other, but we're going to take the prisoners and have them do the grave digging, and give them.
Well, let me tell you something. The grave diggers with PPE are a lot better off than the ones that are inside the crowded facilities with no PPE.
That's true.
These are going to be people out in the fresh air with personal protection equipment, which the people inside do not get. And there is an overcrowded issue with the coronavirus running rampant and numbers of people already testing positive at Rikers Island, where they don't have soap and they don't have hand sanitizer, and they have broken sinks, and you know what I'm saying here, right?
Yeah.
So, I don't know.
Yeah.
Maybe, just maybe, they would be better off doing the grave digging.
Yeah.
But it is a shocking scenario to have to contend with, thinking about how many people we're discussing here.
Yeah.
Let's go to some other comments. Alicia says, so basically my husband can poison me and my death will more than likely be considered a COVID death because of my diabetes. Alicia, are you reading my mind? Are you inside my head? I was having the same messed up, crazy thought. I was like, oh my goodness, like, can you just imagine all of the murdering that could go on at this time? And it possibly, people could get away with it because there's going to be so much pandemonium.
That's right. I'm not going to do that to you, though.
Of course not. And I hope, Alicia, your husband doesn't do that to you either. Okay, moving on. There was also another demise. Let's see. Newsweek reported that essential workers could get a boost of $25,000 under the Senate Democrats' proposed Hero Fund stimulus.
Are the prisoners going to get $25,000 then?
No.
I would consider them those heroes.
No, this is just for frontline workers, healthcare workers primarily. And the raise would be an equivalent of about $13 per hour, and it would apply retroactively from the start of the health crisis emergency on January 27 until the end of the year. And this was quoted from Chuck Schumer. It says that the Senate Democrats unveiled a proposal on Tuesday that would boost the pay of essential workers on the front lines of the battle against the coronavirus pandemic by potentially tens of thousands of dollars. As much as $25,000 in hazard pay would be afforded over a period of time to those deemed essential, including employees in healthcare, drugstores, grocery stores, sanitation workers, truck drivers, transport workers, and all federal employees with frontline positions, as well as postal workers. Not all heroes wear capes, Senate Minority Leader Chuck Schumer said. So this would be retroactive. Healthcare workers would also receive a one-time premium of up to $15,000 as part of a program to recruit and retain certain medical employees in fields that are experiencing shortages. The benefits would be applied retroactively to those already working on the front lines and to the families of healthcare workers who have died as a result of the coronavirus.
Well, I think that incentives like that, I think people should be paying a lot of money for doing what they're doing now.
Yeah.
I think that's a great idea. But the only thing I don't like about this is that has anyone gotten their stimulus check yet? Is anyone not going to get their stimulus check yet? Are we ever going to get stimulus checks yet? Are landlords going to evict us? The Democrats we can do something. Let's do some more money things, and then let's clog the system with trying to get that money out too. So our country is not equipped to give all Americans money like in a week. That system doesn't exist. They're trying through the IRS, and I think it's all good. I think it's going to help people cope. It's going to give people some money, a little bit of money, help them get by for a little bit. But it's still, I don't know, there's something that bothers me about it in the sense that is what the Democrats are working on, and to push out something else. And I know the Republicans are too, and I hope they get some more money out to the people that need it and continue to help people get through this with the finances. I mean, that's very important.
I want to share a comment from one of our listeners that says that they're friends with a paramedic in the tri-state area. Not sure what state they're in, but they are not. The paramedic is reporting they're not getting their usual level of calls, even the usual level, not pandemic level.
People aren't calling an ambulance.
They're not calling, and they're afraid to go to the hospitals,
Yeah.
and that's why many people are dying. That they're not getting medical care assistance, and they're dying at home.
Wow.
That is so scary. And of course, that's going to mean that they're going to be sloughing off virus in a home, maybe that they share with other people. This is going to turn into something very, very ugly.
Yeah.
Nationwide, international news, the WHO has basically hit back against President Donald Trump's statements that he is not going to continue to fund the WHO, the World Health Organization, saying that politicizing the virus could lead to more and many more body bags. This is a comment from one of the WHO leaders in response to the broadside from President Trump. Also, up to 150 Saudi royals have been infected with the COVID virus.
Really?
Mm-hmm. Prime Minister Boris Johnson in Britain remains in intensive care, although reports say he is responding to medical treatment.
Okay.
France is extending its lockdown now past April 15 and has not set a new date to lift and reopen its government. An article in the New York Times questions, are adults living at home with their parents making the pandemic more deadly? Apparently, social scientists are exploring this theory that may partially explain the pandemic numbers in places like Italy and Spain. In those countries, large numbers of working age adults live with their parents, and the younger people may be bringing the virus home and spreading it to their far more vulnerable elderly parents. Far from university expected, this hypothesis has become the subject of fierce debate after a publication of a research paper claiming to find a link between the incidences of adults living with their parents and the deaths from the virus. Some economists have challenged the rigor and the validity of this analysis, and the argument is unfolding just as armchair epidemiologists and self-appointed anthropologists indulge in cultural stereotypes to speculate on matters of grave import. Some even claim that Japan had seen fewer cases because people bow rather than shaking hands.
Oh, well, that's something.
I think some of this is just logical.
Yeah, for sure. You're listening to KPPP LP 88.1 Fargo Moorhead, adding local color to your airwaves.
Yes, you are. And on our show today, we are talking about the COVID casualties. In this article, it says that in Italy and in Spain, a cultural tendency toward intergenerational living was reinforced by an economic catastrophe that forced legions of jobless people to live with their parents again. In the decade after the global financial crisis of 2008, the share of Italians between the ages of 25 and 29 who were living with their parents rose to 67% from 61%. So there was already a lot of people.
Yeah.
According to Eurostat, in Spain, the same cohort expanded to 63% from 51%. Well, there's a lot of millennials that are living at home because of the economic crisis in the whole globe. So I think it's just common sense to keep older people away from younger people, especially if those younger people are still popping in and out of the home. Stay at home to keep everyone safe.
Yeah.
Now let's move to the demise of the Bernie Sanders campaign. Sanders has quit the Democratic race for president, and Biden is to be the apparent nominee. And according to a tweet by Donald Trump, the president tweeted, "Bernie Sanders is out. Thank you to Elizabeth Warren. If not for her, Bernie would have won almost every state on Super Tuesday. This ended just like the Democrats and the DNC wanted, same as the crooked Hillary fiasco. The Bernie people should come to the Republican Party. Trade."
Yeah.
Well, that's what happened the last time. The Bernie people went to the Republican Party and voted for Trump.
Exactly.
I told you that he would not finish the race. I told you that Bernie Sanders would take a dive like he did the last time because he was never in it to win it. And here is the proof. Days after the contest, and with the next voting weeks away, Sanders campaign manager Faiz Shakir wrote that the candidate was going to have conversations with his supporters to assess his campaign. But in a message directly written to supporters, he was more pointed, saying, quote, "No sugarcoating it. Last night did not go the way that we wanted." Speaking about the March 17 losses, adding, "And while our campaign has won the battle of ideas, we are losing the battle over electability to Joe Biden. Oh, too bad. So sad. Ding dong, the wicked witch is dead." Wait, sorry.
Yeah.
And here is one of the people that were campaigning, one of the surrogates of Bernie's campaign. They're just woeful today. This is what was posted by Mr. Jeremy White. The first one is his. The second one is also his. And he wrote, "Not only are the pink kitty hats resistors okay with voting for an old white man," their biggest argument against Bernie, "they're totally fine for voting for a rapist," their biggest argument against Trump. What exactly do they stand for? He's pretty upset at the people that didn't jump, that were part of the Me Too movement on the progressive end that didn't reject Biden as their nominee. They're angry about that. And they're also upset because he suspended his campaign. He said, "It's really difficult to feel hopeful right now Great try, folks.
Yeah, really.
I don't know if it was. I told you he was going to take a dive from the get-go.
He never made me feel hopeful.
I don't think he was ever in it to win it. And the proof is in the pudding. He's just not a Democrat. How is a socialist going to be elected by Democrats in the Democratic Party?
Yep, exactly.
Duh.
Yep.
It was never going to happen. Meanwhile, the con artivists are out there in front of the Trump golf courses, putting out fake corpses in fake body bags, in body bags. They're using body bags to make it look like they're laying out corpses at the entrance of Trump's golf courses.
Wow.
What did you think when you saw this, dude?
Well, first of all, I thought it was a very, very, very stupid demonstration again, and also a really, really, really bad taste.
Look at the picture real quick, because
totally ineffective.
They're not social distancing.
Yeah.
They're out and about, and they're not doing it so that they can go get gas or buy medicine for their grandma. They're not going to the grocery store to get disinfectant wipes or food. They're doing this, and this, by the way, is Refuse Fascism. The same group that I told you has been connected to the Border Support Network and the Standing Rock phonies that opposes Trump, that opposes Pence. It seems like that is their greatest mission on earth. This is what they're doing. It's not something that's mission critical. It's not a safe way of protesting. But of course, they don't care about being safe.
Right.
And what's really disturbing about these COVIDiots is that they are putting people at risk, including trying to defraud folks with fake information and fake tests. According to this post by, what's her name?
Black Elk, right?
Linda Black Elk. Thank you very much. It was right on the tip of my tongue. She posted this Enterprise Community Partners Health and Housing Rural and Native American Initiatives team webinar on her page for it's a Zoom conference, and she wrote, "I will be on a webinar today with the amazing Dean Seneca, whose company designed an inexpensive, reliable test." Please go to the very top where she's posting this, because I want people to see what she says.
Okay.
Where she is hawking this very inexpensive and reliable test for COVID-19 from her friend's company, Dean Seneca, her amazing friend, Dean Seneca, whose company just launched this test that's very inexpensive. Now, why would she be telling people this is an inexpensive test, Duke?
So they buy it.
Right?
It's like they're peddling it.
How can you sell tests if they are not approved by the FDA?
Yeah, you can't.
Who is selling tests in Indian country to unsuspecting people, the poorest people, and telling them that this is an easy and reliable test? Folks, this is very troubling. The company that he works for, the company called Seneca Scientific Solutions, if you look up on their Facebook page, they have a post that says that they just launched their website in February, in the middle of February.
And they developed a test.
You just launched your website, so you're so established and you've been around for so long. You just launched your website last month during the pandemic, and now you're hawking inexpensive tests to natives?
Yep.
This is incredible. Not surprising. Not surprised at all, because I've told you that these phonies, these people, these con artivists, these COVIDiots, they're willing to do anything to make money during the pandemic. They're disaster vultures. They're looking for their next payout, and they are going to do whatever it takes, including defrauding people who want to get a test and have it at their house. I heard Paloma for Trump is now going to be asking for donations for her new documentary that she is apparently going to have some Hollywood producer make for her. out of whatever warehouse she's sleeping in Los Angeles.
Oh my God. Oh my God.
Yes.
Oh, jeez.
Yeah, these people are willing to tell you any lie necessary. You think if Hollywood can't make movies or show movies or documentaries and actors can't get together because of the pandemic, do you really believe this COVIDiot Paloma for Trump can produce a movie during a pandemic?
No.
But that's what they're saying. She's like, now that I have time. Oh, wow. These COVIDiots, they have no shame, folks. They got no shame. Let me share with you what else she's peddling, this Linda Black Elk. She posted this on her page, and then she removed it. And I'm saying she removed it because she made something up that she could not back up. It's called A White Preacher Kills Indian. Could you put up that graphic, please?
Actually, I don't have that one. Sorry.
It says White Preacher Kills Indian. It's right there. And you do have it.
I'm sorry. Yes, I do.
Sure that you have it because I'm seeing it.
There it is.
And she wrote this and then removed it herself. But she said, so they found that SARS-CoV-2, COVID-19, was brought to both Pine Ridge and the Navajo Nation at a church gathering in which a white preacher purposely defied social isolation and said that God would not allow attendees to get sick. Now our people are dying. I'm mad. That's what she said. That's it. And then she took it down and she complained on her Facebook page that Facebook had deleted her post and she was going to call them out on their BS. Well, guess what, Linda? I'm calling you out on your BS because I think that what you wrote here is more Trump dump nonsense.
Yep.
She says, Facebook deleted my post because it violated their Christian Trump supporting guidelines. I provided numerous sources. It's on you. Why not provide the sources again instead of making a video or a post about how Facebook's Trump Christian guidelines had your post removed and your sources and proof removed. Produce the proof again. Tell people where they can go look for the proof without writing about it so that they can't remove your post. There's a million different ways that you could provide the proof that you claim that you have without putting up your BS post. Meanwhile, I just can't even. Oh my God. Myron Dewey is now telling people how to make masks that will protect you from the virus.
Oh, boy.
No cloth mask, and this is what he's showing people how to make, a cloth mask with a bandana, is going to protect you from the virus. It will protect other people from your coughing, from your sneezing, and the reality is there were some directives put out about masks and their efficacy. And this was due to the fact that some unscrupulous people were selling masks, especially to people in frontline, essential worker roles, that were told to the people had the efficacy of an N95 or one of those masks that protects you from the virus, and they didn't. So they were selling fake masks, and there was this whole article in explaining to people that people were selling fake masks and how you could spot a fake mask and tell the difference between a fake mask and a real mask. And this, which is important, is what they said about it. Dr. Ramadan, a pharmacist, said anyone could do some easy tests on the mask that they buy to make sure that it's a genuine mask. If you're testing, you can test it by pouring some water on a mask and holding it. I wouldn't recommend doing that because that degrades the mask. If it's genuine, it wouldn't leak. Yeah, but you'll ruin it, so then it defeats the purpose. I wouldn't do that one. She says also you may try the electrostatic absorption test by putting the mask on some little particles of plastic, like little pieces of styrofoam or some other form of plastic, because the masks that protect you from the virus down to 95%, the ones that are N95s, they're electrostatically charged, you see. And if those little particles of plastic stick to the mask, then you can tell that, you know, the electrostatic charge is there, and therefore it's genuine. The third test is to use the mask, put it on, and blow air through it while turning on a lighter in front of your face. If the air you breathe out permeates the mask and puts out the lighter, your mask is a fake. And just to show everyone that this mask that he is peddling to people can be done, remember, a general mask must consist of several layers of melt-blown rather than woven fabric. It shall then block light and transmission and not easily catch on fire. So a mask made out of bandana, it doesn't protect you from the virus.
Yeah, exactly.
The test, the lighter test, is not for you to test whether or not you're protected from the virus. It is to test whether or not you got a fake mask. Okay?
All right.
That's what it's for. But Myron Dewey is using it to show people how the mask he made with a bandana works. Take a look.
One way to test your mask is with a lighter test. Okay.
I don't even know if he's trying.
Hold on.
He's not trying.
Blow again.
He could totally put that out if he wanted to.
And last one. This is really close. I don't want to go too close, but blow hard as you can.
Oh my God.
This mask also has a tea filter inside.
Ooh, the tea filter. That's what's doing it. They just won't give up. They won't give up on their nonsense. They won't give up on their nonsense. And I mean, I hope that the folks that are caught doing this kind of COVIDiocy are reported and told to stop, because this stuff can actually be dangerous. We don't need COVIDiots putting people at risk with misinformation, especially with these fake tests. We know don't by the way, don't buy any tests. Tests are supposed to be provided by the CDC, by the hospitals, by the state, by the government for free. You don't have to pay for them. In the last weeks, a lot of direct-to-consumer health companies like this one announced that they were going to start selling do-it-yourself home-based coronavirus tests. But the Food and Drug Administration made it very clear that those are fraudulent test kits that were not authorized by the FDA and that you should not buy them. This is the quote. If you see a coronavirus test for sale that promises to test you at home, do not buy it. Quote, we want to alert the American public that at this time, the FDA has not authorized any test that is available to purchase for testing yourself at home for COVID-19. Okay? So Linda Black Elk and her buddy over with the Seneca Lab, you can't be selling tests to people. It's not approved by the FDA. Stop trying to make money off of this pandemic. And on a lighter note, ABC News reported out of Mexico City's hospitals that mariachi musicians were playing tribute to the medical personnel for their battle against the COVID pandemic. Here are some pandemic mariachi for you to enjoy. Almost all of them, except for the trumpet player there, is wearing his mask because he can't wear his mask.
Exactly.
And they're not doing the social distancing well at all. But here's some pandemic mariachi for you. They're standing right next to each other. Oh, wow. They got the full concert from the mariachis.
Mm-hmm.
Well, folks, I want to send out a special thank you and support for all of the frontline workers, be they truck drivers, doctors, nurses, grocery store, checkout people, all of you that are putting yourselves out there, protecting the health and the well-being of the rest of us in America. Thank you from the bottom of our hearts, from A Mexican Crossing Lines at 88.1 FM, and from everyone in our community. And thank you all for joining us tonight here on my show, A Mexican Crossing Lines, covering the COVID casualties with your hosts, Cindy Gomez-Schempp
and Duke Gomez-Schempp.
You're listening to 88.1 FM, KPP PLP Fargo Moorhead, where we are adding local color to your airwaves. Have a blessed day and have a great evening.